Wash your hands, do-do-do-do-do. Wash your hands, do-do-do-do-do. Wash your hands. Grab some soap, do-do-do-do-do. Grab some soap, do-do-do-do-do. Grab some soap, do-do-do-do-do. Grab some soap.
Welcome to the Dr. Theo Show. It's been a while since official episode, so I thought, why not tonight? And with a message to bring you, I've had this song stuck in my head, and hopefully now you can too. To wash your hands, do. Okay, today is the last day of June the 30th, 2020, and we're going to talk a little bit about coronavirus cases, deaths, and potential prognosis going forward. Once again, significant amount of talk on the internet about what is serious, what is not, what is fake news, what is real, what is trustable, how much of this is all political, and so forth. And there's still a lot that we don't know, which I've said since the beginning. So, tonight we'll talk about what we know, and we'll talk about possibilities going forward. Only time will tell. So first of all, let's get the elephant out of the room. Greene County is now officially covered in coronavirus. It's something that we all knew would happen, but hoped, I guess, that wouldn't. And the point of tonight's talk is not to panic, but to be prepared with the things that I've been coaching you for the past several months. So last Monday, Greene County, Tennessee had 0 active cases. On Tuesday, there was 1 active case. And then as we went through the next several days, we went to 3 and to 8 and 12 and 18 and now 24 and 27, if my numbers off the top of my head are correct. And don't know severity of some of these yet. We still have, obviously, the vast majority of previous cases that are recovered and 2 fatalities here in Greene County. So that's where we're at now. And we've gotten here from 0 cases to 27 active cases relatively quickly, based on what we know from other parts of the community and a few direct messages that I've gotten. A decent amount of these appear to be due to travel, people coming back from vacation from hotspots, like Myrtle Beach, South Carolina, and Hilton Head, South Carolina. When we look at surrounding counties, places like Morristown, Hamlin County, their cases are going up a little bit faster than other areas are. Knox County continues to have a slow increase. Sevier County, once again, increasing. A few weeks ago, we had a post going viral where I recommended avoiding travel to these areas, and that was due to the rate of increase. The first week of June, Sevier County had 90 new cases, and the next week they had 190 new cases, essentially. And at that kind of rate, that's concerning. That's things we have to pay attention to. Now, new cases doesn't necessarily mean deaths, okay? And right now, a lot of people are pointing that out, that, okay, cases are going back up, but deaths aren't going back up. So that's what we're going to talk about tonight. What does this mean? Well, there's kind of 3 things that this means. First of all, the potential most obvious to those of us in the medical field would be, well, let's not call the end of the race quite just yet, because as these cases are going up, and we're having 35 to 40,000 new cases of coronavirus each day in this country here the past week or two, that there's a certain delay into the point where people get more critically ill and eventually potentially die. So we may see that death toll here a few weeks from now. So it's not a clear cut that there's a rise in cases and not a rise in deaths, because we're still not quite there. Although about a month ago, we were having closer to 20 to 25,000 new cases per day. Some days it would get closer to 30,000, but that's ballpark kind of where we were. Sometimes drop down towards 15,000 per CDC reports. So right now we're at about double the amount of cases compared to last month. And right now not seeing an extreme utilization of resources or deaths, at least not in our state. Tennessee so far has had a lower mortality rate of closer to 1.5% confirmed cases to deaths, whereas nationwide we're still sitting around 5% of confirmed cases to deaths. Long term, those numbers will go down once again as we have more and more people that test positive and more people that are younger that will be healthier and be less likely to die. So we're still thinking that mortality rate will be much lower at some point. We just don't know exactly what. I initially estimated around 1 to 2%. I revised that recently down closer to about 1%. The CDC a few weeks ago estimated potentially 0.26% mortality. And just this past week, I did see a report that they revised that upwards towards 0.5% mortality as well. So once again, why are we not seeing a huge spike in deaths? Because every week I've been posting the total death rates and the amount of deaths in this country from the virus. And at least the past few weeks, I've been pleasantly surprised to see there hasn't been an uptick. Now, once again, that may change here middle towards end of July, but maybe not. So 3 things that could mean here today on June the 30th. Number one, like we just said, it could just be we're looking at this too early and this influx of cases maybe hasn't infiltrated the most vulnerable populations, just the people maybe going on vacations. The concern for that is as they bring it back to communities, then you go to church, you go to the grocery store, eventually gets into a nursing home or some other vulnerable population, and those rates could go up. So we don't know that, but it could be good news that we're seeing that here right now. Second scenario of why we wouldn't be having more deaths at that point would be comorbid other viruses or co-infections at the same time. So I did hear reports, for example, of some people that had both coronavirus and flu back several months ago, and that was even more overwhelming to the system. Initially through March, we even had protocols to where if you were swabbing somebody for coronavirus, you couldn't even swab them until you had a flu or strep screen. And then if you had one of those be positive, based on the protocols and the guidelines, you couldn't go on and screen. So it could have been possible more people were co-infected with other viruses that you wouldn't be able to fight off. And luckily right now we're just not seeing flu. So that would be very, very good news. And the third reason that we may not be seeing death rates as high as maybe what we had previously would be, well, we shut things down. We now have enough protective equipment in the hospitals, and hopefully fewer hospital workers are getting sick. We know a little bit more as far as treatment of this virus goes. We know some things that increase mortality and some things that decrease mortality. And we found that some of the largest complications of coronavirus include blood clots or deep vein thrombosis in the legs that can go to the lungs, put a lot more stress on that and other organs, shut organs down, and so forth. And so the knowledge now that using blood thinners to prevent or treat these blood clots has a pretty significant effect on mortality. Another study came out that said high-dose steroids in the most severely ill was helpful. We don't know exactly when to administer that at this point unless someone's seriously ill. The initial cautions were don't do it early on because steroids can worsen a course of disease, but at least now we have that information. Hydroxychloroquine and chloroquine and azithromycin still don't really have any good evidence. There still appears to be risk. There's still some trials that are ongoing, so we'll determine if there is a benefit and if there is, when that is. And once again, that's a cheap medicine, wildly available everywhere. Remdesivir did have some initial promising results, but not anything major, and there were some conflicting studies, both here and overseas. Some showed some benefit, some showed no benefit. Super expensive medication, but maybe we're doing a little bit better job from a treatment standpoint. Also, if you've noticed from watching previous interviews, then we know that turning a patient in the prone position on their stomach also helps improve clearing secretions. So once again, that's 3 potential reasons why right now we're not seeing a dramatic increase in death rates. Number one, that maybe it's just too early and that we're going to see that, but that Hopefully, it's younger, healthier people getting this. Number two, we maybe don't have flu or RSV or paraflu or the human metapneumoviruses or all the other things that could have been going on where people were being co-infected with multiple viruses, which absolutely can happen. And then number three, we're just getting better treating it. So that's kind of the three things to look at. So I come to you tonight hopeful and optimistic that we're getting better at all of this. The downside to all this is, as a country, we're still doing very, very poor compared to other countries at containing, controlling, and mitigating spread of the virus. Several other countries took much more dramatic measures than we did, and they have either close to eliminated or on their way for eliminating. Now, some of these countries do pretty extreme measures where they completely shut down borders, completely shut down all parts of economy except for access to doctors, hospitals, pharmacies, and grocery stores. There's some pretty significant stuff that some folks are doing, and we'll see if that pans out. So far, that does seem to be working for them, but there are other consequences to shutdown. So I'm not advocating here for a shutdown. In fact, I've been advocating for the opposite. What I'm saying is, hey, there's still a lot we don't know. We don't know if there is going to be this uptick and if there's going to be more deaths coming than the 125,000 we've already had. So, hey, let's wash our hands. Let's keep 6 feet apart, preferably more. Be smart as far as outdoor dining, washing our hands and other routine hygiene practices, and covering our mouths when we cough. We have to dab cough. We have to dab sneeze, okay? We can't be coughing into our hands and then touching everything and spreading everything around. But right now, our country accounts for roughly a quarter of the worldwide confirmed deaths. And our rates compared to other countries are going up on a per capita basis and an overall basis. So we're still in the first wave. It feels like the second wave. Our current goal is to not overwhelm our health system. I'm not going to be able to convince people that don't think masks work and believe other things on the internet just randomly, because people are going to believe what they want to believe. And I guess that's okay. You can't change people, and you can't make people care about others and be respectful. And I've learned a lot about people throughout this, and valuable lessons myself of where to put energy into and ways to reach out to people. Some efforts have been successful and some backfired, but I'm okay with it. My initial goal was to hopefully lessen severity locally so that we lose as few people as we can, but also that we keep our businesses open. You know, if one business tests positive, they just about have to shut down for a few weeks. I don't know about you guys out there, but if that happens to my business, I've got a lot of overhead and a lot of staff, and they depend on me and my partners. And 2 weeks without a revenue stream, that's very difficult. That's assuming a mild case or mild cases at that point, compared to some of the prolonged hospitalizations and other types of things. That's the leaving thought I would have with you is, you know, if you're listening to this and you're young and healthy, you're going to most likely survive coronavirus. I'm not that worried about you. But if you're young and healthy and you get this, you might be out of work for 2 weeks or 4 weeks or 6 weeks. You might end up with hospital bills, or you might end up giving this to a loved one or a sweet person at church, or maybe someone your age or younger with compromised immune systems or bad lungs or other health conditions. And if you get diagnosed, you're going to have to look back and say, where have I been? And who have I been around? And what precautions did I take? Okay? People are asking me at this point, hey, what do I do? So-and-so had this virus, and they were friends with someone that I'm friends with. They've hung around, and then I've hung around them now. And what do I do? Do I quarantine? And there's some difficulty in providing exact information in an imprecise world here. But in general, if you think you've been exposed, you do need to isolate. You do need to stay home. You do need to wear masks. Of course, you need to do that whether or not you've been potentially exposed or not. Treat the world as if everyone else has the virus, but also treat the world as if you have it and you're trying to not spread it. This is simple stuff. And once it's all over, we can look back and say, wow, here's what we should have done. We should have never done this. We should have for sure done this. And I can't believe how silly we are. But right now, we don't have that luxury. Right now, it's just like a football game. You're making the best decisions that you can going forward. You don't know what the other team is going to throw at you. Now, I don't know about you, but every time I watch a UT football game, I can always point back to 2 or 3 plays or coaching decisions or poor timeout use or whatever else. It's really easy to look back and be like, why did you throw the ball? Why didn't you run the ball? It's really easy to do that. But when you run the ball and you score, like, man, yeah, that coach did a good job, right? Well, that's kind of what we're doing here too. We're using the best information we can to game plan. And looking back, absolutely, as a country, we could have done things better. We should have done things better. But there's a significant amount of things we need to do better right now to plan for the best outcome. That's wearing a high-quality mask. In a perfect world, that's an N95 or KN95 or surgical mask. But also, high-grade cotton masks, as I posted this week, still are helpful. In fact, the Wake Forest study I quoted showed that if you have at least 180 thread count and multiple layers in that, at least 2, there were a few other studies looking at 4. Some people are using interface material. If you at least have a high-quality DIY or homemade mask, you're having potentially 79% personal protection from the virus, but also you're helping to reduce the spread of other people. These are important things. If you wear a mask and that someone else wears a mask, that dramatically reduces your risk for infection. That's science at this point. You're not breathing in your own carbon monoxide or carbon dioxide or whatever else like that. That's ridiculous, okay? The size of carbon dioxide, it's 3 atoms, okay? You got a carbon and 2 oxygen. I mean, atoms are teeny, teeny, tiny, okay? The average virus is about 100,000 atoms in size. So you're not restricting carbon dioxide levels or oxygen levels. Okay, now, should you go running or playing football with a mask on? No, I'm not saying that, okay? That's completely different. But if you're interacting and going through a grocery store or going to church or interacting with other people in your community in a indoor setting, yeah, you need to wear a mask, okay? This isn't rocket science. We're not asking you to like donate a spleen or a kidney or something to your neighbor. We're asking you to wear a dang mask. And how are us medical professionals being treated for such crazy advice? We're called various political names that we don't have an affiliation with. We're told to go educate ourselves by these Facebook doctors. Now, don't get me wrong, that doesn't get to me. It just makes me kind of facepalm. And how dumb we are as a society and where we get our information. And calling people sheeple. What's up with that? People that call people sheeple are in fact themselves sheeple. Except for me calling the sheeple, if you follow. Okay. That's all for tonight. We've talked about current cases. We've talked about a rise in those cases. So far, no major local overwhelming of systems, although we are hearing reports out of Texas and some ICUs that are starting to get full, so we need to start paying attention from that. But if we do start seeing reports of the larger cities having similar troubles that New York had or Italy had, where their hospitals became closer to capacity and a lot of people were dying, we should probably learn from that. All right? This is going to be a long battle. And the reason is because if this was more serious, everyone would take it seriously and follow precautions. If it was less serious, I wouldn't be here talking right now. This is just serious enough to where we're potentially going to lose 1% of our population. And some of you care about that and some of you don't. But I care. you never know when grandma or ma or your significant other or your sibling is going to die. I think that's a side of medicine that someone not in medicine actually doesn't see. I've lost a couple of patients in the past few weeks, and none of those were due to coronavirus. But still, both of those were unexpected. Both of those were people that should have lived for many, many more years. But it's hard on your family doctor when you lose a patient, a friend. And it's hard when that happens from, cancer or heart attacks or suicide. We don't have time to dwell on it. We have to keep moving on. We've got more patients to see. You can't dwell on these things, but it's not easy when you build a relationship with a patient and then they die and you don't get to say goodbye and, hey, thanks, it's been nice talking with you for the past few years. You don't get that opportunity. It's that hard enough. Losing someone to something preventable and addressable like coronavirus, I highly dread and hope that I don't have to go through. So we're going to keep fighting, and I appreciate you guys liking and clicking and sharing and commenting. Even you trolls out there, every time you trolls click and post an article or refutation, that actually does help disseminate the good scientific message. So, keep trolling. But I don't know, maybe listen and something may sink in sometime. I care about you. If you're still listening, that means that you care about others. So thank you. And don't give up. We're going to get through this. It's going to be okay. We're not going to have to wear masks forever. But we might have to through next spring or summer. And if we do, if we all buy into this, we'll not only save lives, but who knows, maybe we can keep our schools open. Maybe we can keep our businesses flowing and not have more layoffs, not have more shutdowns. I personally want to sing Rocky Top all night long this fall on multiple occasions. I mean, come on, y'all. I went to the University of Tennessee 15 years ago, and we were ranked number 3 in the nation my freshman year. And we finished unranked and had a losing season. The past 15 years, other than a few bright spots, haven't been that great. And we've got an overall pretty good team. Still need a quarterback. Need to replace some wide receivers, but the big boys are strong, okay? And if you don't wear a mask, we may not be able to have football. Or if we do, there won't be any fans in the stands. Can you imagine watching college football with no fans in the stand? That's just not American. It just ain't right, okay? And these Alabama fans, these Georgia fans, these Florida fans, they're advertising masks. I see them pop up on my feed. You can go buy you a Georgia mask, or a Florida mask, or an Alabama mask. Nick Saban's really pushing the mask. He says how important they are. I respect the guy, but I don't want Alabama to beat us in hygiene and football, okay? And if we don't get this hygiene stuff going on, we ain't going to have no football, or our team's going to catch it. Then they're going to, oh, great, we're doing a great team, but now our offensive line all has coronavirus. They have to quarantine for 2 weeks. So, oh well, what could have been? Let's not have that. You got to find some motivation, something that you care about. And if you know people that aren't wearing masks, you have to find something that motivates them or someone. But hopefully we won't have to have a lot of people die before everyone takes this seriously. All right. Thanks for tuning in. And remember, as always, Dr. Theo says, stay 6 feet apart or 6 feet under. The choice is yours. Have a good night.